What can you do with a PA degree that is outside of direct patient care? I know NPs, nurse practitioners, can teach, do management, education, etc. Is it the same for a PA? Yes, and much, much more. So you can do much more than just practice hands-on with patients when you're a PA. So like this person said, you can teach. You can teach in APA school without getting any further degree. Of course, if you want to advance in education, you want to be a director at some point, you want to be something more than a professor, it would be good to get like a doctorate in education or some sort of an advanced degree, even like a doctorate in PA studies, which I wouldn't recommend for anyone clinically, but I would recommend if you do want to go like leadership in education, something like that. So yeah, you can teach even just with your PA degree without getting any sort of advanced degree. You can also work in management. So for instance, you're on a neurosurgical team, you can move up the ranks to be managing that team to where you're doing more admin work or like half and half clinical and admin, that kind of thing. So you're still part of the team, but you're doing more admin, more leadership, more organizing, kind of more Zoom meetings, more emails, more logistics, that kind of thing than you are actually being hands-on and practicing. And that's the same with a lot of bigger teams, bigger organizations, even like in urgent care, not the company I work for now, but in my previous company, we had PAs who were kind of like in leadership roles, either in education, their main role is to like educate the newer PAs that work for the organization, or they are in charge of like a fellowship, or they're in charge of just people in generally, like they'd be my manager, they'd be my boss, people I go to, but they're spending less time practicing clinically, if at all, and they're just kind of a manager who is uniquely suited to that role because they are a PA, they have practice, they understand like my wants and needs and things I need to do my job, so they're kind of in the ideal way or in the ideal position to be that sort of a manager. So management is always possible. Research is always possible. There's certain things in research where you really need a clinician, not a researcher. So for instance, when I was doing my post-bac, one of the nurse practitioners that was part of that program, that was a professor in that program, also spent a lot of her time doing research, and she would do some of the procedures that were necessary. So they were studying, I can't remember exactly, but some kind of effect that something has on muscles. So she ended up doing a lot of muscle biopsies, which you definitely need to be a clinician who knows how to do those things. You can't be a PhD, non-clinical type person. Sometimes I think they're allowed to, but I think usually they would want a clinician. So you could be a clinician, you could be part of the research, you could be doing the actual research and writing things. I don't know if you'd ever be like a PI, excuse me. I don't know if you'd ever be a PI, like a principal investigator. I think you'd have to have a PhD or at least a research master's for that. I'm not certain, if somebody could correct me in the comments, but you can certainly be part of a research team. Other things you could do, you could be part of a what do you call it, like a law firm or something, or an insurance company handling like claims. You could give like not medical advice, what do they call it? Like when they need a clinician to kind of give their opinion about a claim, whether it should be accepted or not. Like you could work for an insurance company, you could work for a law firm doing like workers' comp law and stuff like that. What else? There's so much you can do. One thing that I feel like a lot of people don't really know unless you do this yourself is not workers' comp necessarily, but just occupational medicine. Occupational medicine is a huge and hugely in demand field. So a lot of bigger companies, they'll have their own like doc, which is usually a PA or an NP, that kind of handles their legal aspect and their medical legal aspect of keeping employees healthy, like they get hurt on the job, they might handle their workers' comp. Things like DOT, like the Department of Transportation, if somebody has a commercial driver's license or has to drive a truck, there's certain DOT exams that you have to be certified, and it's this rigorous program that you have to do. So some people do that. Some people start their own practices just doing DOT exams because the demand is so high and so few people are DOT NRCME medical examiners like myself. Very few people have that. So some people just straight up start their own businesses just doing DOT exams, because few people know how to do those and they're pretty few and far between. So that's another thing. I know a PA that started her own practice, and she doesn't have like an office, she does mobile. So she has this whole thing where people just subscribe to her service and they can text her throughout the day during business hours, and then she'll go to their houses for things like Toradol shots, for physical exams, abscess draining, stitches, stuff that like they would come to me in the urgent care for. She goes to their houses and does it, and it's her own business. She has like a supervising position on paper, but she's essentially the sole proprietor of the business. She's the only employee, the only provider. She basically manages herself and just talks to her supervising physician as necessary. So starting your business is always a possibility. I know plenty of nurse practitioners, at least through the grapevine, that have their own cosmetics thing, like lip injections, Botox, that kind of thing. They might have a supervising position. I'm not certain if they do, but a PA could certainly do something like that. What else? There's countless opportunities as a physician assistant, aside from just working at a hospital or working at like an office or a clinic. There's so much you can do. I'm trying to think if there's anything else just right off the top of my head, but let me think. So obviously practice medically, teach, start your own business, do your own procedures, do occupational medicine and occupational health, where you work for not necessarily a clinic or even yourself, but you could work for like a company. Like Amazon hires people like that, where they just have their own like workplace health clinic or something, like a minute clinic just for their employees. So you got stuff like that. You could do telehealth. I know like psychiatric telehealth is a big thing. So like people can go to counseling online, but like if they need medication, some people are prescribers like myself. You can prescribe medication. Some people do that over the internet, so you could do something like that. Obviously there's stuff like what I'm doing right here, consulting, like helping people to get into school, helping people with their careers, getting their careers and everything going on. There's so much you can do, man. There's so much you can do with a PA degree. Probably not as much as you could do with like a medical doctor degree, but it's also a much easier degree to get. Very, very hard degree to get, but compared to like a medical doctorate, it's not that much. So I know this was just kind of me just spitballing and rambling, nothing super organized, but the point of the matter is there is so much you can do with a physician assistant degree besides just working in a clinic or at a hospital. There's a lot of options if you're creative especially. All right, thanks for the question.